as we officially launch tomorrow. My name is Cate Lane. I am the Director of Adolescents and Youth at FP 2030. Very quickly, just so you have a sense of who I am a white American. I have brown eyes and a mix of silver and dark hair. I wear bright blue glasses, and I won't share my age, but I've been working with adolescents for about 30 years. So that should tell you. With the generous support of FCDO, we awarded a small grant to Pathfinder International to develop a module on meeting the sexual and reproductive health needs of adolescents living with disabilities as part of Pathfinder's most recent edition of its very popular training manual for healthcare providers on how to provide quality health services to young people. Pathfinder in turn partnered with Humanity and Inclusion to not only develop this new module, but to ensure the entire manual was more inclusive of the diversity of all young people. Events of the last 2 years remind us of the imperative of acknowledging diversity and committing to inclusivity. This manual will no doubt be an important tool for all of us as we continue on the journey to make health systems more inclusive of young people and open to the wonderful diversity of all young people. Training healthcare providers is an important first step in improving the quality of care for young people. And we hope this new manual sparks even more interest in and intent to acknowledge the health needs of all adolescents and youth, regardless of age, marital status, parity, and ability. A couple of points. Please drop any questions you may have during the session in the chat box or in the Q&A window. Also, if you want captions, please see the bottom of the Zoom ribbon, click More, and then click Show Subtitles. Looking forward to this session. And now I'd like to pass it over to my colleague, Emma from FCDO.
Thank you very much, Cate. My name is Emma Žaja. So you're all aware, I am a light-haired British light-skinned woman wearing a black and white patterned top. Thanks so much for having me here and for inviting me to deliver the opening remarks. Is the sound okay, Cate? Your face made me think it might not be.
No, it's fine. No.
Great, great. It's a real pleasure to be here with you all today to hear from such a fantastic panel, including health and programme professionals, advocates, and youth with disabilities. I am a social development advisor at the UK's Foreign, Commonwealth and Development Office. Up until a few weeks ago, I was working in the Sexual and Reproductive Health and Rights Central Team, but I have recently moved to working in the Disability Inclusion Central Team. So as you can tell from my bio, this session really brings together two areas that I'm passionate about and think are really important: SRHR for adolescents and youth, and disability inclusion. FCDO is committed to protecting and promoting the sexual and reproductive health and rights of all people. And this extends to and totally includes adolescents and youth with disabilities. People with disabilities have the same sexual and reproductive health needs as everybody else, but they have historically been denied their rights, facing additional barriers to services, information, and education. And this is unacceptable. We need to work together to ensure that the health sector is an inclusive space for everybody. And we know that adolescents and youth with disabilities do face these additional barriers in accessing information and services. So we need to think about how to ensure there are the right tools, such as this fantastic manual, to remove those barriers and ensure that service providers have the skills to provide truly disability inclusive quality SRH services. We know that when people with disabilities are empowered to access quality, comprehensive SRH services, they become more able to enjoy their full sexual and reproductive rights on an equal footing with everybody else, as they should. these conversations like the one we're having today are so important. Bringing together experts across the SRHR and disability inclusion sectors will help us all to promote disability inclusive SRH services and information. So I welcome you all here today to enjoy this session with all of us on the line, and join me in celebrating the launch of the 3rd edition of Pathfinder's Training Manual for Service Providers. Now I will hand over to Zekia. Thank you.
So the Zekia will be using my computer, and she can continue.
Hello.
We can hear you.
Okay, sorry, because the internet actually is so disturbing, and that's why I'm using John's computer. Thank you so much actually for giving me this chance to participate here from South Sudan. I'm Zekia Musa, HI South Sudan as an inclusion assistant. So we as an advocate, actually, we believe that if you want to advocate for the solution of the problem, first you have to identify, the problem. And that's why what I did. And I was able to identify some of the barriers that's actually causing the problems towards youth with disabilities here in South Sudan. And I just want to share with you, and plus the enablers that are able to overcome those barriers. So just to begin, with the attitudinal barriers, because this is the most barriers that actually affecting persons with disabilities, and especially the youth in accessing the reproductive health services. These attitudinal barriers actually affecting the use of persons with disabilities right from their family, the community, and the service providers, and especially the health service providers. These people, they have their own cultures that they are viewing as persons with disabilities, that we are actually not deserve to be given the reproductive health services because youth with disabilities are not sexually active, So for this reason, they are not, deserve to be given those services. And this is the most barriers that are causing challenges for persons with disabilities. The physical barriers, just to go on, the physical barriers. Hello, yes, the physical barriers, actually the Convention on the Rights of Persons with Disabilities, it's saying they are very clear that for persons with disabilities to access the rights and to enjoy their equal rights with others freely without, accessibility. So when I'm talking right now, our environment is not really accessible. Environment, the health facilities is not accessible, and even the convention itself is not being signed by our government. This is another challenges that we are facing by the physical barriers. Then go also to the policy, to the communication barriers. This is mostly based with the people with hearing impairment. It's really challenging for them to access the information because nobody is trained, in sign language interpretation. So these people actually, they are becoming even the victim of SGBV. And actually those are the barriers that we're really facing, plus the policy barriers. Our institution, they are not actually using the policies that guarantee the rights of persons with disabilities. Now, who is to advocate, why we are advocating for this inclusive sexual health reproductive services is just because of these barriers and the policies that guarantee the rights of persons with disabilities. We are using those policies so that we'll make sure that the inclusivity is in place. Right from our Constitution of South Sudan, the Transitional Constitution of South Sudan, they are in Article 31 is stated very clear that persons with disability, they have, right to be given the services. And also the Convention on the Rights of Persons with Disabilities, Article 25, they stated very clear that persons with disability are part or partial from the community. They have, to be deserved to be given those rights. And the National Disability and Inclusion Policy, those policies actually, they are supporting us to advocate on these inclusive sexual reproductive health services. Then the enablers. Now, how are we able to overcome those barriers, and who are those actually doing these facilitators? Because we have our motto that says nothing should be done for us without us, and it is us persons with disabilities are the one doing the advocate, and I'm the example on this, and that's why we are advocating for the rights of persons with disabilities, and we make sure that everything should be in place right from the inclusivity, and we make sure that we are the one who doing the training, especially to those of service providers, and also we are doing community dialogue, we are doing awareness outreaches with the service providers. And now even their attitudes changing towards persons with disabilities, even the medias, they now giving their space freely to persons with disabilities to echoing their voices. And even I myself, I am now conducting the specific program on disability forum every Sunday. I'm doing, the program that concerning persons with disabilities. And I'm very happy with that. And we really very happy with our government with the move that they are taking towards persons with disabilities, though we are witnessing challenges many. So because of this time, I will just want to stop here, and I'm going to hand the mic to my colleague, Mr. Noel. Thank you so much.
Hello, everyone. Hello, can you hear me?
We hear you great, Noel.
Okay, thank you very much. My name is Noel Maro. I'm working with Pathfinder on the Scalar Family Planning Project as a youth project officer, and I'm supporting Central Zone of Tanzania. I'm very passionate about supporting youth, especially those living with disabilities, and also those in marginalized areas. About scaling up family planning project in Tanzania, this is a program that aims mainly to ensure that women, especially youth and people with disabilities and those living in marginalized area, can safely plan for their pregnancies and improve their sexual and reproductive health by ensuring the provision of quality reproductive health and family planning services. This is a consortium led by Engender Health, partner with the Pathfinder International, DKT, and the CCBRT. And in this consortium, Pathfinder mainly provide technical leadership in issues of adolescents and youth reproductive health component of the program, while CCBRT provide technical guidance on how to work with people living with disability. So to ensure that the quality of service to youth and people with disability is of a good standard, we normally provide training to service providers, as well as on-job orientations to service providers and the community health workers on adolescent youth-friendly service. And we normally do this by using national curriculum with the addendum on disability package. And normally this is offered by expertise, our colleague from CCBRT. This training normally equip these service providers with some key skills and key skills on issues of communications, mobilizations, and how they can best provide the youth-friendly services to young people and people living with disability. As we all know that sometimes one of the barriers of these young people accessing reproductive health is the issues of provider barriers. So this training also aims at addressing issues of provider barriers on serving young people. On us, we have one of the providers who was trained on issues of youth friendly service. And because of issues of network and to be assured of him, we have filmed him. So we display his videos. The provider was very comfortable speaking in Swahili, and we know that, but we managed to insert some English captions. So while we'll be speaking, you might be following on the caption below. My colleague can display the videos for you. Thank you all for listening. Welcome.
Naitwa Martine Johnny, muuguzi natokea zahanati ya Buzirayombo, wilaya ya Chato, mkoa wa Geita, Tanzania bara. Zahanati ya Buzirayombo ni miongoni mwa vituo vinavyofanya kazi kwa kushirikiana na mradi wa Scaling Up Family Planning. Hamasa ya kufanya kazi na vijana na watu wenye ulemavu nilipata tu mara baada ya kupata mafunzo ya huduma rafiki kwa vijana na watu wanaoishi na ulemavu, mafunzo ambayo yalifadhiliwa na mradi wa Scaling Up Family Planning. Katika mafunzo haya nilijifunza kwa namna gani naweza nikawahamasisha vijana, nikatoa elimu, na kwa namna gani naweza nikawahudumia vijana na watu wanaoishi na ulemavu. Kwa sasa hatusubiri tena kituoni. Badala yake tumeandaa ratiba ya kuwatembelea vijijini. Na hii ratiba tumeiandaa kwa kushirikiana na wahudumu ngazi ya jamii. Kwa sababu hawa wahudumu ngazi ya jamii wanayafahamu mazingira, lakini pia wanaishi kule kwenye jamii, wanajua watu gani wenye uhitaji. Kwa hiyo tunafanya hivyo, tunawatembelea na watu wanapata hamasa, wanajitokeza kwa wingi kupata hiyo huduma ya afya ya uzazi. Lakini pia tunafanya kazi na vikundi mbalimbali vya watu wanaoishi na ulemavu. Hii inatia hamasa watu kujiunga na huduma ya afya ya uzazi kwa vijana na watu wanaoishi na ulemavu. Tunashauri Wizara ya Afya kwa kushirikiana na wadau, watoa huduma waliopata mafunzo ya hii huduma ya vijana na watu wenye ulemavu ni wachache ukilinganisha na jamii tunayohudumia. Kwa hiyo watu wengi sana wanatamani wapate hii huduma, lakini kulingana na uchache watu wengi hawafikiwi. Kwa hiyo Wizara ya Afya kwa kushirikiana na wadau waweze kutoa ili wahudumu waweze kupatikana kwa wingi na watu hii huduma rafiki kwa vijana na watu wenye ulemavu iweze kuwafikia. Mwisho, natoa shukrani zangu za dhati kwa Wizara ya Afya, Maendeleo, Jamii, Jinsia, Wazee na Watoto na wadau kwa kuweza kuliona hili na kutoa mafunzo ya huduma rafiki kwa vijana na watu wenye ulemavu. Kwa sababu kwa sasa hivi watu wanapata hii huduma na wanaifurahia na wanajitokeza kwa wingi. Asante.
Thank you for the video. We are so thankful for the generous support from FCDO and the technical guidance from Engender Health as our leading partners in this consortium. So thank you very much.
Thank you for this video, and good morning, good afternoon, and good evening, everybody. I'm Alessandra Aresu. I'm the Director of Global Health at Humanity and Inclusion, and the next presentation it will be from me. Humanity and Inclusion is an international NGO. You may have heard the name also as Handicap International, or also as HI. And HI is dedicated to globally promote the right of persons with disabilities and vulnerable population globally. Promoting sexual and reproductive health and rights for all, and particularly for persons with disabilities, is a major component of the work of HI around the world, as we are present in about 60 countries with flagship programs on inclusive sexual and reproductive health and rights in about 13 countries. And we are able to do so thanks to the support of different donors. First of all, FCDO in East Africa and Southern Africa and in Asia, through the Women's Integrated Sexual Health Program and the Disability Inclusive Development Program. But also thanks to other donors like Global Affairs Canada, where thanks to this donor, we are also present with inclusive SRH projects in West Africa. Young people, and particularly young people with disabilities, are a priority in all of our projects that are implemented with key partners, such as organizational persons with disabilities and international NGOs. And some of the international NGOs we work with are also represented here today by some of you. I'm sure that some of you comes from organizations like IPPF, MSI, Care International, and IRC. But in fact, we also partner with other disability-focused organizations like HI, for example, Sight Savers and Leonard Cheshire, or also with some UN agencies. The reason why I'm referring to partnership in such a length is because really in the few minutes I have, I want to make sure to highlight that in the last few years, partnerships like the one I have referred to here have been key for many of us to promote inclusive sexual and reproductive health and rights globally. And the partnership have been instrumental to collect, for example, evidence about the significant need to work on inclusive sexual and reproductive health and rights that remained overlooked for such a long time. Partnership is also important when it comes to highlight the need to move forward in promoting the rights of young people when it comes to sexual and reproductive health, considering the number of young people with disabilities in the world and the fact that they are often left behind when it comes to sexual and reproductive health and rights. It is essential to keep them in mind, and partnership have helped us to do so. Thinking also that a significant part of young people with disabilities live in low and middle income countries where we all work. And again, partnerships have also been essential to better identify the barriers that young persons with disabilities face in accessing sexual and reproductive health information and services, like the one we have heard about in previous presentations, but also to identify lessons learned on how to address and remove those barriers, and also to identify enablers that were mentioned earlier on. In fact, the training manual that we are officially launching today and that brought us together today is really a key tool when it comes to addressing and eliminating barriers, including attitudinal barriers. And this is why it is important to talk about it, because this manual contributes to raise the awareness of sexual and reproductive health workers on the right of young persons with disabilities, but also provide practical inputs on how to offer the best information and services in a respectful and inclusive way for all. It is a key example of how different organizations and teams from Pathfinder, Humanity and Inclusion, and FP 2030, with the very complementary skills and expertise, can produce a tool that will guide sexual and reproductive health workers in their work to better support and inform all young people, including persons with disabilities. Marta will say more later about the manual, so I will not enter into the details of the content, but before passing her the mic, I want to provide a frame that will help us, I hope, to better understand the value of this manual and to plan for the next steps on inclusive sexual and reproductive health and rights. The frame I propose for you is the one of inclusive health that revolves around the three key principles of accessibility, non-discrimination, and meaningful participation of persons with disabilities and representative organizations. Inclusive health is a sector that has received increasing attention in the last 2 years, at the beginning as a result of the discrimination faced by many persons with disabilities in accessing COVID-related information and services, and still today in accessing COVID-19 vaccines. And because COVID has exacerbated the barriers persons with disabilities face in accessing health information and services in general, including sexual and reproductive health information and services, in fact, has also contributed to create a new space for discussing about disability inclusion in the health sector and to promote the right to health of persons with disabilities. So I invite you to think about the importance of this manual that we are launching today and of inclusive sexual and reproductive health and rights within this new available space, and how to take advantage of this space for our advocacy and programmatic work. This manual becomes available in a very unique time for us, really a peak time for promoting disability inclusion in the health sector, and specifically sexual and reproductive health and rights. And the reason why I say that is a unique time is because only a few months ago, in May 2021, the World Health Assembly has adopted the resolution, the highest obtainable standards of health for persons with disabilities, a groundbreaking document that calls, first of all, the WHO members, states, and all the relevant stakeholders to work to ensure the rights to health of persons with disabilities, and ensure that the rights to health of persons with disabilities is promoted, respected, and fulfilled. And my colleague Rosanne is putting in the chat the link to refer to the WHA resolution in case you're not familiar with it. It is really the very first document of this kind, and specifically refers to sexual and reproductive health and rights as one of the key sectors, and refers to young people as a key population. It also reminds us that inclusive health and inclusive sexual and reproductive health and rights does not exist without the respect of the right of informed consent of all persons, including persons with disabilities, and that today this right is consistently violated through forced abortion, forced sterilization, forced family planning. And that promoting inclusive sexual and reproductive health and rights means, first of all, to ensure that all persons with disabilities of all ages can choose about their sexual and reproductive lives. And this is really an important point, the one on informed consent, that I really would like you to keep in mind when discussing about inclusion in sexual and reproductive health. The WHA resolution, it also reminds us that persons with disabilities are not an homogeneous group, and that persons with multiple disabilities are often the most marginalized and need our full attention. And this is also something that I would like to highlight and for you to keep in mind. It is a key tool, the WHA resolution, and we need to give visibility to this tool and to advocate for its implementation to ensure it doesn't remain words in a document. This is also a role that we can play. But in fact, it is represent also a tool for us, a tool that we can and have to use when we advocate in our daily work for inclusive SRHR. Because this resolution tells the world that what we are asking for is not a priority of a small group, but a global priority recognized by all the member states. I will now highlight two other reasons why this is a unique time for inclusive health and sexual and reproductive health before passing the mic to Marta. The next reason is that there are also, these are also the months during which we are preparing for the Global Disability Summit that will take place in February 2022, hosted by the government of Norway and the government of Ghana. And my colleague Rosanne will put a link in the chat in case you are not familiar with this event. This is a key event to promote disability inclusion, and that refers to inclusive health as a key priority, and for which governments, NGOs, and all other stakeholders will share commitments on how they are going to contribute to inclusive health, including inclusive sexual and reproductive health and rights in the future. So for those of you who feel comfortable, please go to the Global Disability Summit webpage, read the content, and draft some commitments that you may want to consider in your future work when it comes to inclusive sexual and reproductive health and rights. These are also months during which WHO is working on a new global report on disability that will bring together data, lesson learned, experiences, and recommendations on inclusive health, inclusive sexual and reproductive health and rights. And data is essential for the work that we do. We need evidence to advocate and to design better projects. So this report will really be a key of key importance for all of us. So we cannot really find a better time to officially launch this training manual and to take this opportunity to advocate for inclusive sexual and reproductive health and rights here today. But also to plan for the future steps. And the future step revolves for us also to remember that the complementarity of the different stakeholders that today are around this virtual table is essential when we want to implement quality actions and bringing together different experiences and resources to join our strengths in a common effort to ensure that inclusive sexual and reproductive health and rights move forward. And this is important also because a key conference is coming up in 2022, the International Family Planning Conference that will take place in about 1 year time. Then we have the opportunity to ensure that disability and youth inclusive sexual and reproductive health and rights has a place at the conference. And it is now the time to plan together and to move the next steps towards this objective. I hope you were familiar with some of the content I have shared, but for more questions, I'm very happy to refer to more details during the Q&A session. Thank you all. And now I pass the mic to Marta.
Thank you, Alessandra, and thank you everyone up to this point. My name is Marta Pirzadeh. I am the Senior Technical Advisor for Adolescent Youth Sexual Reproductive Health and Rights at Pathfinder International. For those of you who can't see me right now, I am a light-skinned American woman with silver and black hair pulled back. I'm wearing a white high neck sweater and have light brown and pink glasses on. I'll follow Cate's lead, and rather than tell you my age, I will tell you that I've been working in global health and adolescent youth sexual reproductive health for about 20 years, and I'm very glad to be here with all of you. If Elida, you could start the slides, that would be great. Great, there they are. Okay, so before I get into the topic of disability inclusive SRHR information for adolescents and youth, I'll tell you that Pathfinder is one of the earliest organizations to recognize and act on the unique SRH needs of adolescents and youth with programming back to the 1970s. Over the years, we've implemented adolescent and youth focused programs in more than 40 countries in Africa, Asia, and Latin America, really creating a wealth of experience and learning that we continue leveraging today to expand facility-based youth-friendly services, as well as community-based adolescent and youth health and well-being approaches. In the adolescent and youth space, we're particularly, or perhaps most closely associated with and widely credited for our long-standing leadership in advancing adolescent and youth-friendly and AY responsive SRH services, which is an important part of what we are discussing today related to young persons with disabilities. Today, Pathfinder continues to build its reputation and legacy as a youth-forward organization by integrating AYSRH within each aspect of our work, from our vision to our research, our advocacy, and our program delivery. So I'm excited to share this new resource with you today, and thank all of you again for being here. Next slide, Elida. As Alessandra mentioned a few minutes ago, that persons with disabilities are not a homogeneous group, I wanted to just remind you and acknowledge that young people, adolescents and youth, are also not all alike. You can see on this slide that, you know, they vary greatly, not just by age and gender, but also by their lifestyle, whether they're married, whether they're living with a disability, living with their parents, perhaps they themselves are young parents. So I wanted to just give you that frame as we think about how diverse the population of adolescents and youth are broadly, and also young persons living with disabilities are not just identifiable as a young person with a disability, but a very complex person with many, many layers, as this slide suggests just a few. So it's really important that when we design programs and resources that we take in consideration their heterogeneity, and that these and that we are adaptable. Next slide, please. I'm not going to give too much detail about this slide, but drawing from a variety of literature reviews, and a number of service delivery elements were identified that can increase contraceptive use among adolescents. And you can see what some of those are here on the slide, related to enacting supportive laws, but also implementing and ensuring that those laws are being implemented and accessible to the young people within their community. Training and supporting providers to offer non-judgmental services, which is something that we're talking about today. Enforcing confidentiality, as Alessandra mentioned, informed consent and ensuring audio and visual privacy, offering a wide range of contraceptive methods, as well as offering free or subsidized services and integrating contraceptive services with other services, which could include, but not limited to, STI management, HIV counseling and testing, comprehensive abortion care services, and postpartum care. And finally, another evidence-based practice is, offering services in multiple outlets and different service delivery channels. So we know what works. We also know what doesn't work. And, we're trying to build upon the evidence that we've learned over the years. Next slide, please, Elida. Excuse me. Despite a real need for quality health information, counseling, and services, many young people, and in the case of what we're discussing today, particularly marginalized or young persons with disabilities, find it difficult to obtain healthcare services that are youth-friendly or youth-responsive. Although there are many factors that are essential to the provision of youth-friendly and youth-responsive services, it is arguably the service provider in the facility or community who is the linchpin of youth-friendly service delivery. So if we're able to strengthen the ability of service providers to provide accurate, unbiased, and empathetic care, then we are more likely to reach young persons, in a healthier way, and they are able to get the services that they desire and need. This is central to Pathfinder's efforts to facilitate the health and well-being of the young people that we work with. And these skills to reduce provider bias can be developed in several ways. For many, and oftentimes in many of the projects that we work with, and many of you I'm sure work with, such as what Noel was talking about earlier, and within the Scaling Up Family Planning Project, we often use established curricula and training or through workshops to ensure that providers are getting the information as well as the bias reduction necessary to be a strong service provider. So you can see these are just a few of the many biases that we know that service providers have, that don't allow young people to access the services that they require and that they want. So perhaps, you're familiar with more, certainly, that certain family planning methods are not for young people, or that young unmarried people should not be sexually active, or that on the flip side, that they need to prove their, fertility once they're married. And finally, what we're expanding upon today is the bias that young persons with disabilities are not sexual beings. And we're trying to work with providers on these and many of the other biases that are often held. Next slide, please. So as we started talking about, there are ways to make SRH services more youth-friendly and youth-responsive. The importance of training providers is one of those approaches to strengthen their abilities to provide accurate, unbiased, and empathetic care, as I mentioned. And we're going to talk just now in a few minutes about the important information and skills that young people, or I'm sorry, that providers need to provide this type of unbiased access. It's ever evolving to meet the needs of young people. And so, as Alessandra mentioned, the resource that we're going to talk about, or we are talking about, is in its 3rd edition. Next slide. So as was mentioned by both Cate and Alessandra, you know, we are launching today the 3rd edition of a resource that Pathfinder has had for quite some time. You can see here that this is a partnership between Pathfinder FP 2030 and Humanity and Inclusion with support from FCDO. To give you a bit of history, in 2002 and revised in 2004, Pathfinder developed a comprehensive family planning and reproductive health training curriculum for service providers to improve their ability to provide RH services to adolescents and youth, and to make these services more youth-friendly. It was designed to prepare the providers to provide this quality reproductive health service, but also to train physicians, nurses, counselors, and midwives all over the world. It's often considered a gold standard in this arena, and parts of the module may be adapted for use with community-based workers or auxiliary workers. All of the modules in the curriculum are designed to actively involve the participants in the learning process. They're very interactive. There's not a lot of didactic learning. And the sessions include simulation skills practice discussions and case studies, role plays, and using objective knowledge, attitudes, and skills checklists. But if you remember, I said the last time it was revised was in 2004. It needed a refresh, you can imagine. And so from this opportunity, this partnership between the 3 organizations here, as well as with support from FCDO, we're excited to share the 3rd edition of the popular training curriculum with you. It was formerly known as Module 16, Reproductive Health Services for Adolescents. You might be familiar with that. And the new edition is entitled Developing an Adolescent Competent Health Workforce, Training Service Providers in Adolescent Sexual and Reproductive Health. So in addition to providing up-to-date technical content, the edition takes participants through an array of exercises and activities to help them more fully explore their attitudes, beliefs, and values, and how those influence their interactions with young people. And to get to this point, we revised and reviewed the existing curriculum with a sensitivity to disability issues, integrated inclusiveness, developed a full new disability module, and then field tested it in Tanzania and adapted and finalized it over the past few years. Next slide, please. So this resource is hot off the press. It is available online. We'll share the link with you now in the chat box. Please take a moment to go to the link. There's a lot of information there. All of the different modules can be accessed independently, or you can access the entire resource by clicking on different thumbnails within that resource. So we're excited to share this with you. We hope that you will take a look at it. Feel free to reach out with questions to me. I think you can find me on the Pathfinder website, and we're thrilled to continue this partnership moving forward, hopefully with opportunities such as those that Alessandra mentioned, upcoming meetings and conferences. We're proud to be part of this work, and thank you for the opportunity to share it with you. Now we're going to move over to the Q&A session, give you all the opportunity to ask questions to the panelists also to review our polling questions from earlier. We do have one open-ended question that we'd love to share with you. If you could put that up in the screen. So the question that we wanted to ask you is, how can we better support young persons with disabilities, and particularly, specifically to access sexual reproductive health programs and services? If you could think about that for a minute, and please put your answers in the chat box about ways that you think we could better support young persons with disabilities. That will begin our discussion. And I'm going to hand it over to my colleague, Sophia Heffernan, to lead the Q&A. Thank you again.
Thanks, Marta. Hello, everyone. My name is Sophia Heffernan. I'm the Global Initiatives Associate at FP 2030. I am a 25-year-old, as of today, Caucasian woman who has red hair, and I'm wearing a striped sweater today. Thank you all again for joining today, and I'm going to ask if we could, I don't think I'm seeing any responses from the current question, but feel free to continue to put in your question or your answers to the question on the screen. However, you will have seen a quick pop-up of the poll questions that we asked at the beginning of the session. And I'm going to go ahead and read them out. What barriers young persons do those with disabilities face when it comes to accessing sexual reproductive health and rights? So I see that most folks chose all of the above, which is the correct answer. Folks, face barriers such as physical barriers, policy barriers, provider barriers, financial barriers. Sometimes all of them at the same time, sometimes individually. Great. So, and then you can just continue to see the responses. True or false, young persons with disabilities are just as likely to be sexually active as their peers with without disabilities, excuse me. And that is indeed true. So thank you for answering these questions. And we're now going to move into the Q&A portion of this session. As has been mentioned, please feel free to add questions into the chat box or into the Q&A feature. We'll be able to access them during the session. So please feel free to continue asking questions as we go.
Hi, everyone. It looks like Sophie has frozen for some reason. I hope you can all hear me. Oh, Sophie, are you back? Okay, you're back now. You had froze for a minute. Why don't you continue?
Oh, so sorry.
That's okay. If anything you said in the last minute, we did not hear.
Oh, okay. Well, I'm glad to be back. Maybe I'll just go off camera just in case anything happens again. Well, I was just getting started with the Q&A portion of the session, and to start us off, I was going to pose a question to all of the panelists and speakers who have asked or who have spoken today. And the question is, what can we do differently to ensure the right to informed consent is respected and fulfilled for all youth, including those with disabilities? So again, feel free, speakers, to just come on your either camera or off your mic and begin this conversation.
Hi, Sophie, I'll go ahead and start. I think what's really important was one of the things that Zekia said at the very beginning was we sometimes focus a lot on the physical barriers that people with disabilities face. So we go in and we install ramps in health facilities, or we provide different types of educational materials in different formats. But I think the fact that she really zeroed on the fact that it's provider attitudes and beliefs that really are the biggest challenge and the barrier to young people accessing services. And providers usually represent the beliefs and attitudes of their community. So it's simply, in my mind, simply not enough to train providers, but we have to work within communities to help communities acknowledge and see young people with disabilities, or all people with disabilities. And in my experience and working in a number of countries around the world, because sometimes disability is so common in many places, people with disabilities are kind of overlooked. So it's important to not only train providers, but to work with communities to acknowledge that people with disabilities exist in their communities and that they are sexual beings, and at times they even may be vulnerable to things like sexual abuse or other types of inappropriate sexual contact. So not only working with healthcare providers, but building the capacity of communities to be supportive of people with disabilities.
And I will go next. This is Alessandra speaking, also taking the opportunity to describe myself as I didn't do it before. I have an oval face, I'm wearing glasses, and I have a gray and brown hair. And I'm Italian and I'm wearing a red shirt. And to follow up on what Cate just shared, definitely going beyond the service providers is essential to work on informed consent. And when thinking about communities, I would also pay attention to parents, because of course, no matter if we are speaking about young people with or without disabilities, parents tend to be extremely protective, tend to be present in the life of young people, and sometimes to take decisions for them, thinking about their best well-being and their well-being, but sometimes simply not fully taking on board the idea that their daughters and their sons have the right to be informed and to take their decisions about and being autonomous in taking their decision about their sexual and reproductive health and life. And the other elements that is also very important to highlight is that young people with and without disabilities need to be informed to be able to be autonomous in their choices, because information is core, is crucial for to take their decisions. And for this reason, working with young people outside the clinic, outside the hospital, and making sure that they can have access to comprehensive sexuality education, on any way information on gender and sexuality, will make them more aware of what are their rights, and they will be more autonomous and in the best position also to speak their mind in front of their parents and in front of the service providers. So it's really a very complex work, but essential, that brings together several elements to make sure that everybody does his or her own part in ensuring that the right to informed consent is really respected and fulfilled. Thank you.
Thanks so much, Alessandra and Cate. I hope that everyone was able to write those down, just their great responses to that question on what we can do differently. So thank you both. Our next question is from the chat, and it's a question for the implementers on the line. Have you found that stigma comes in greater amounts from other young people or from adults? How do you address those issues of stigma in a different way among those populations? So again, feel free to just come off of mute or off camera to answer. And again, this question is mainly directed at the implementers. Thank you.
Thanks, Amy, for this question. I think as an implementer yourself, you could probably answer this question, and please feel free to jump in, anybody as well from the group, participants, if you have responses to these questions as well. I think this is a really important question, Amy, and everyone that speaks to the importance of doing work within the community itself, and not just, I don't know the answer to this. I think it probably varies by setting, or others might have particular experiences around whether stigma comes from other young people or from adults. I think comes from both. We all know even within families, oftentimes young persons with disabilities are treated differently than their siblings or by their relative, other young relatives. For example, they're, while they, their siblings may be getting prepared to move into the next stage of their life or to finish school or to get married, this may not be even a discussion or a consideration for the young person with a disability from their own parents or family members. And so I think that, while we are trying to address these issues, particularly today, we're talking within the service delivery, provision, working with providers. This is a much broader community issue, working with young people themselves as well as with their families and community members, through values clarification, education, ensuring that the young people within school settings and non-school settings understand that these differences, these disabilities are simply differences, as they are all different, as I mentioned earlier. So I think it's a complex question, of course, coming from you, Amy. You always have the good questions, but I welcome others to jump in, either participants or panelists who have experiences to share. Thanks.
Thanks, Marta. I'm curious, Zekia, I wonder if you have some thoughts on this, not to put you on the spot. But I know that you're doing a lot of this work in your day-to-day.
Hello, this is John.
Hi, John. Yes.
Yes, maybe I can just answer on this question. Yes, during our interaction with the young people in the communities, of course, stigma plays a big role that due to the attitude of population, the community, in that in the regards that SRHR services are only for married persons, maybe for an adult. So whenever, because of a lack of confidentiality, you find when a young person come for service provision to the facility, there are a lot of their parents, their friends of the parents, there are elderly people who are in the facilities, even service providers. They quickly end up reporting the case to the parents that, today I saw your child or your daughter in the facility taking contraceptives. In that, it become an issue that made many young people not going to the facility to take SRHR services. So this is a common thing that we found, especially in South Sudan. But how do we address that? Mainly is it working with the youth directly in youth-friendly spaces, in areas that are friendly spaces for youths, going to the places of playing grounds, or to the youth centers, or even to the OPDs centers that they are always gathering there. Then that will make it easier, because it is not easier for parents or the service providers to report, because these services are taken directly to the youth-friendly centers. Then it becomes easier, because many young people fear to go to the facilities because they fear they will be reported. But how do we address it is going to the youth-friendly spaces and dealing directly with the youths. How we can, and we involving as a solution, how do we want us to reach with the services? The second issue is the community dialogue that we normally deal with the community leaders, church leaders, different women groups during our outreaches. That one make it easier to reach young people in the outreaches and in the communities than in the facility. So when we have focus group discussion, we have outreaches to the communities. It makes it easier for people to see SRHR service become a normal, and it become for everybody. So through this, we find the youths are normally are easily getting that. But when you see during the outreaches and outreaches find many youths come for the services compared to the facilities because they fear the stigmatization from service providers and from the community. That's how we normally handle it.
Thanks so much, John. That's really informative. And thanks for jumping in there. I believe we have time for just one more question before we close out. And I believe I'm going to turn it over to Emma. And the question is, what does the evidence say about the state of peoples with disabilities vulnerability, for instance, to GBV, gender-based violence? Any information on the scale of the issue there?
Thank you, Sophia. I saw this question come in from an attendee, and it's actually something that I was looking at just a few days ago to start to pull together some information on that. So I thought I would share just a couple of headlines that I came across. So one is that women and girls with disabilities are 2 to 4 times more likely to experience intimate partner violence than women without disabilities. So that's quite a significantly increased vulnerability there. We have also seen that women are at risk, increased risk of gender-based violence due to the intersection both of the gender bias and the disability stigma and discrimination. So it really builds on top of each other, and they face this double discrimination and the resulting violence as a result of that. And I also just wanted to mention, because somebody raised humanitarian and crisis settings earlier on. The evidence shows that during humanitarian crises, children with disabilities are at higher risk of abuse and neglect, and women with disabilities are at higher risk of sexual violence than their peers who are living, who don't have disabilities. So I hope that helps just to start the conversation on that. And it's a really, really great question, really important, and the links between how we support people who have experienced gender-based violence with sexual and reproductive health services, but also to defend their rights is so important. So thank you to the person who raised that.
Thanks so much, Emma. And unfortunately, some harrowing, statistics to end on, but thank you again for all of your questions. And we do know that we didn't get to all of the questions, but we have them written down, and we'll try to get them answers to you all in the coming weeks. But thank you again for participating, and I'm going to hand it over to my colleague, Cate Lane.
Thanks, Sophia. I see people are dropping off quickly because we've reached the hour, but I just wanted to share a couple of observations. One is that this webinar is incredibly timely, given that WHO has released a statement about ensuring the health of people with disabilities, the World Disability Forum that's coming up, as well as ICFP coming up next year. So I think this is it's a really important time for us to mobilize our resources and continue to shine a spotlight on the needs of people with disabilities, including young people with disabilities. A couple of other observations. Training is important for providers, but because providers often reflect the needs, the norms and attitudes of their communities, we need to go beyond just training providers, go beyond just improving the physical space for people with disabilities, but work with communities to generate more supportive community norms around the sexuality of adolescents living with disabilities, as well as recognizing their potential vulnerabilities, as Emma has just shown. We need to continue, as family planning service providers, we need to continue to expand our partnerships with organizations that reach these underserved populations, such as people with disabilities. Disability rights groups, and continue to advocate to ensure that all people's rights are respected, including those with disabilities. Their rights are respected for good health. Sorry, that came out a little garbled, sorry. And then finally, my final comment, I guess, is that we've picked a lot of low-hanging fruit over the years. We've reached sort of the mainstream. I think we've done a good job of reaching, sort of the mainstream of people who have a need for family planning, and it's beyond time that we really focus on diversity and inclusion and bringing in those underserved and overlooked populations into the general population of people that we serve. So very, very happy to have supported the development of this manual. Looking forward to disseminating it to our colleagues in the field and then continuing to work with Pathfinder International and Humanities and Inclusion on reaching this highly important yet underserved population of people. Thank you so much. And I think this is the end of the webinar.
Thank you all for joining.
Thank you, everyone.